Hello everyone, welcome back to Last Night Dentistry, our channel. Today we are going to discuss a very important and high yield topic, oral submucous fibrosis, commonly known as OSMF. This is one of the most commonly asked potentially malignant disorders in BDS exams, especially in Asia, in your Pakistan, India, Nepal, Sri Lanka region, because oral submucous fibrosis is a chronic, insidious scarring disease of the oral mucosa that leads to progressive stiffness and difficulty in mouth opening. It is considered a precancerous condition with increased risk of oral cancer. It mostly affects people in South Asian countries due to traditional chewing habits. Let's understand it in detail. Before starting the video, please subscribe and like our video so we have the motivation to make such videos in future as well. So, first, etiology and risk factors. The most common cause is betel nut or Areca nut chewing. Other contributing factors include Gutkha, tobacco, and excessive consumption of hot chilies. Ericoline present in betel nut stimulates fibroblast proliferations, leading to excessive collagen deposition. This disease is like scleroderma, but limited only onto the oral cavity. If you remember one thing from this lecture, always ask about pan, gutkha, or betel nut history in the exam. Now, let's discuss its clinical features. Patient usually complains of progressive trismus, difficulty in mouth opening. The buccal mucosa becomes pale, blenched, and firm. There is symmetrical involvement. Other sites includes lips, soft palate, and sometimes pharynx. In early stage, there is burning sensation on eating spicy food. In advanced cases, the mucosa looks leathery, tongue becomes atrophic, and mouth opening may reduce to less than 20 millimeters. This condition is commonly seen in young to middle-aged males with long-term chewing habits. Now, in another slide, we have key clinical sign that examiner loves to ask. You will see blanching of mucosa due to decreased blood supply and palpable vertical fibrous bands in the buccal mucosa. Cheeks lose their normal flexibility. So there is exam scenario: a 35-year-old male from Bombay with 4-year history of Gutkha chewing and mouth opening of only 15 millimeters. This is a classical presentation of OSMF. Okay, that having a mouth opening of only 15 millimeters. That is way beyond the normal one. Coming on to the histopathology of OSMF is very straightforward but very important. In the early stage, there is chronic inflammation in the submucosa. Later, you see dense, hyalinized collagen bundles, reduced vascularity, and atrophic thinned epithelium. Muscle degeneration can also occur in severe cases. The atrophic epithelium is more prone to dysplasia. That's why it has malignant potential. This is the reason for its malignancy potential. Now, talking about OSMF is a potentially malignant disorder. The risk of transformation into squamous cell carcinoma ranges from 2 to 8%. The atrophic epithelium is more susceptible to carcinogens. That is why long-term follow-up and biopsy of any suspicious area is mandatory. Always mention malignant potential in your Viva answer. It shows good understanding. Diagnosis is mainly clinical. History of betel nut chewing plus blanching mucosa plus trismus is usually enough for its diagnosis. Biopsies done to confirm fibrosis and to rule out dysplasia. Differentials include scleroderma and atrophic lichen planus, but the habit history helps differentiate OSMF easily. Now coming to the management. Management of OSMF, the most important step is complete cessation of the habit, betel and tobacco. Treatment includes intralesional steroid injections, systemic corticosteroids, and physiotherapy with mouth opening exercises. In very advanced cases, surgical release may be attempted, but results are not always good. Antioxidant and nutritional support also help. Remember, there is no complete cure once fibrosis is advanced, so prevention is better than treatment. Now, here are some high yield points for exams. Most common etiological agent is betel nut or areca nut. Most common clinical sign is blanching of mucosa plus fibrous bands. Histological hallmark is dense submucosal hyalinized fibrosis. Malignant potential rate is 2 to 8%. Best treatment is habit cessation plus intralesional steroids. So OSMF equals Trismus plus betel nut plus precancerous conditions. Now we got some revised question. Most common cause is betel nut chewing, and if you got a scenario that a 28-year-old male with Gutkha habit for 5 years present with pale buccal mucosa and mouth opening of 17 millimeters, what would be the most likely diagnosis? And the answer is oral submucous fibrosis. So also know that it is a potentially malignant disorders. And what are the histopathological features of OSMF are atrophic epithelium with dense submucosal fibrosis. Treatment of choice in moderate OSMF are intralesional corticosteroid plus habit cessation. So these are the most repeated concepts. Practice them regularly. Now that's all for today. Lecture on oral submucous fibrosis. This is a very important topic for your BDS exams. So revise these slides